Have you ever overheard a grandparent, a parent, or even a spouse that snores so loudly that you want to throw a pillow at them? I have grown up hearing the snoring my entire life, and I can tell you I've honestly wanted to throw a few pillows. The American Academy of Sleep Medicine estimates that 29 million Americans have been diagnosed with obstructive sleep apnea, and that is only 12% of the population that should be diagnosed. Today we will explore the symptoms of obstructive sleep apnea, how it is diagnosed, and popular treatments. Obstructive sleep apnea is characterized by several things. The first one that often a patient notices is daytime sleepiness. Daytime sleepiness can be mild or severe. In a mild case, a person may feel like they didn't get a good night's sleep or they just need to rest a little bit more. But in the most severe cases, they can feel like they cannot drive because they are impaired, or they can have narcolepsy where they can just fall asleep anywhere. Usually, spouses are the first to report the next symptom, which is snoring very loudly. The snoring can be caused by a couple of different things. For one, it could be caused by an obstruction in the mouth, whether that is an unusually large tongue or a large uvula. That's the little thing that hangs down in the back of your throat. It can obstruct the throat and cause that snoring. It can also be caused by being overweight. If you have a large girth to your neck or an excessive amount of weight on your chest, it can just make it more difficult for your body to take those deep breaths when you're sleeping, especially if you're laying in certain positions like laying on your back. Apnea episodes are the other characteristic, which are the main characteristic of obstructive sleep apnea. Apnea is when a patient stops breathing for a few seconds. When this happens, patients often wake up gasping for air. This is very frightening and prevents patients from entering into a deep restorative sleep. Obstructive sleep apnea is diagnosed using polysomnography, and it can be done diagnosis-wise in an in-lab sleep study or at home. In a sleep center, a person will be monitored by technicians. They will be visually watching their breathing, how their chest rises and falls, eye movement, and leg movement. They will also be monitoring some internal things going on with the patient. They'll be hooked up to an EEG, which is an electroencephalogram, so it measures the brain waves. They'll also be hooked up to a vital signs machine, which measures oxygen saturation and heart rate. An in-home test measures similar things, but it does not do the EEG. A lot of people prefer to do the in-home test because of the comfort of being in your own home. It is also more affordable. So I have a picture to show you of the test. In the first picture right here, you can see there's a technician here, and this patient is getting hooked up for their in-lab sleep study. And as you can see, there are a lot of wires on them, and you can see the electrodes on their face, and that's to measure their brain waves. In this picture, you can see a patient doing an in-home sleep study. They have a belt around their chest, which will measure how their chest rises and falls. They also have a pulse ox, which measures oxygen saturation, and they have a nasal cannula in their nose. So you can see that. That's going to measure how many deep breaths they're taking and if they're taking deep breaths. Okay. There are multiple treatments available for sleep apnea. The most common treatment is the continuous positive airway pressure machine. It's also known as a CPAP. This machine helps push air into your lungs, pushing past whatever obstruction so that the patient is getting adequate oxygen. Now, there is an adjustment period. Oftentimes, people find the machines uncomfortable and they need support to start the treatment and continue the treatment. Spousal support can increase compliance in the first 6 months of use. Other things that can help increase compliance are having the right fitting mask. So, in this machine, in this picture, I'm going to show you a picture of a machine. This is a common CPAP. As you can see, there is a hose that's coming off of it. This is the button that turns it on, and so it's just going to push air into the patient. In helping a patient feel comfortable, there are several different masks. This mask is a full face mask. As you can see, it covers the nose and the mouth. In this mask, this is for people with severe sleep apnea or who are mouth breathers. There's also a nasal CPAP, which only covers the nose for patients who don't need the support of the mouthpiece. And lastly, there is the CPAP, a nasal pillow CPAP for even more comfort. It just allows the patient to have less objects on their face and making them feel more comfortable. Along with the CPAP, there are other variations of the machine that can adjust the pressure, like a BiPAP and an AutoPAP. The AutoPAP adjusts pressures automatically. The BiPAP has to be set. Obstructive sleep apnea is a common disorder that often goes undiagnosed. If you notice the signs and symptoms of obstructive sleep apnea in one of your family or friends, you can help improve their quality of life by directing them, moving them in the right direction for testing and treatment. My purpose in giving this speech is to inform you of common and an easily treatable sleep disorder. Remember, there are 29 million people living with this diagnosis and millions more that have yet to improve their quality of life through a good night's sleep.